Hello, everyone. My name is Ariana Cameron, and I'm going to be presenting a presentation today to go over what is hypertension. The contents that I'll go over and include in my presentation today are going to go over what the prevalence, demographics, risk factors of hypertension are, the pathophysiology, signs and symptoms, the cultural considerations to take into view, nurse tools, education that I give to my patients, and a conclusion. So what is hypertension? Hypertension is when the force of blood is being pushed rapidly against the walls of the arteries. High blood pressure can begin at a systolic pressure of 140 and a diastolic pressure of 90. They often say the perfect blood pressure is 120/80. So pre-hypertension is anywhere in between the 120 to 139 range and 80 to 89 diastolic. So the prevalence in the United States for hypertension. There's a 29.1% reported in 2012 of how prevalent hypertension is in the US. The prevalence between men and women are different in that it's when men age and get older above the 55 and older range, they tend to have more of an increase in hypertension. Demographics and risk factors. The lifestyle, obesity, smoking, family history, heart disease are also known as risk factors. Lifestyle being having a sedentary, relaxed lifestyle, not so much having a daily or a few times a week exercise regimen. Smoking, excessive alcohol can also change what the normal blood pressure rating is and cause some hypertension. Demographically, men have a higher incidence of hypertension than women. There's also a high percentage of hypertension in the population of Hispanics and African Americans. There's reported that 42% of the population that has hypertension is African Americans, and 60% of the population with patients with hypertension are elderly. The pathophysiology. Chronically, elevation of high blood pressure is seen. Hypertension can lead to heart disease, arterial damage, renal failure. It can also increase in cardiac output and the vascular pressure. In this increase goes the pressure causes an increase in vasoconstriction and resistance. As we go into the next slide, I'm going to explain some additional high blood pressure symptoms. Having high amounts of anxiety can increase the blood pressure. Headaches is another sign of hypertension. Feeling tense, heart palpitations, sporadic nosebleed or continuous nosebleeds on and off can be a sign of hypertension, as well as breathlessness. So the signs and symptoms. One of the most serious factors with hypertension is that it can be known as silent, meaning that there could be no sign or symptom with a patient for them to determine that something is off within their body and that they have high blood pressure. In fact, a patient that's young, thin, and athletic that tends to have sometimes a low pulse ranging in between sports or activities with a higher pulse and may have a headache here and there, they can go with hypertension without that being noticed. Another side effect is severe headaches, migraine-like headaches, dizziness, blurred vision with floaters. Often patients say they see little white spots. Can lead to stroke, heart attack, aneurysm, peripheral vascular disease, renal failure, and optic nerve damage. So there's cultural consideration to take into place. The Hispanic and African American backgrounds have a higher rate of hypertension. Their consumption of what they eat in their diets, as far as high salt enriched foods, high sodium amounts in their diets, and a lack of potassium, high fat in the diet, and a lack of exercise. Obesity, diabetes, and family genetics also play a part. So for nurse tools and education that I would give my patients and my family, assessment of family history. Patient history and any underlying conditions that can be a cause for a risk factor. Given the patient that has newly diagnosed hypertension and those patients that have chronically hypertension, as well as the patients that have risk factors but have not yet been diagnosed with hypertension, giving them patient education on checking their blood pressure at home or stopping by a Walmart pharmacy, Walgreens to have their blood pressure checked is very important. Education on risk factors, medications that they may be taking, and some medications that can tend to rise blood pressure, and the positive reinforcement on improving their diet, increasing exercise, or adding exercise to their daily regimen to help reduce some of those risk factors. Assessing the blood pressure readings and planning. Having a blood pressure log at home if they do have hypertension, and having them check their blood pressure daily, write it down so the next time they have their appointment at their primary care, they can go over what their readings have been. This also helps to know if blood pressure medications are adequately working. So some of the ways to beat high blood pressure naturally: changing the diet, of course, reducing any stress factors, improving sleep, and overall grounding your body healthy. In conclusion, living with hypertension and not knowing can result in a cardiac disease and even death. Very dangerous. Results of hypertension can lead to stroke, MI, renal failure, and being aware of what the family genetics and history is the best option to better manage hypertension. Once being diagnosed, taking your proper medications, learning about those medications and side effects, and self-monitoring the blood pressure at home is much needed. For my family, we have a high prevalence of hypertension. Just about every aunt, uncle, mom, dad, grandparent has hypertension throughout the years. So for myself, being young, I monitor what I eat. I make sure I have exercise included in my weekly regimen at least 3 days a week, and I drink plenty of water. These are my references, and thank you for allowing me to present my presentation today on hypertension.